Welcome, my name is Markash. I'm a qualified yoga therapist and I hold a master's degree in psychological research. Welcome to day 14 of the program. This will be the final video focusing on the physical manifestations of trauma. In this video, we're going to be learning techniques that are going to help you with all the physical symptoms that we've covered in the previous videos, whether it's anxiety, panic attacks, chronic pain, sleep disturbances and insomnia, or dissociation and numbness. These practices are going to be beneficial for you. In these 3 techniques that I'm going to be guiding you through, we're going to be focusing on vagal toning. So all of these techniques will focus on stimulating, healing, and restoring the vagus nerve response. And this is a very, very important tool to help you if you are struggling with symptoms of trauma. All of these practices can be done whenever you're feeling a bit anxious, whenever you're feeling tension in your body, or just feeling a little bit overwhelmed. All the practices I'll be guiding you through can be done in a seated position. This can be done in a chair, on your couch, in the comfort of your bed, or if you prefer, you can come to a seated position on the floor. The first practice is going to be creating a sound. So if you would prefer just to have the doors closed so that you don't feel disturbed, please just take a few moments to get the room into a comfortable and safe space. And then when you're ready, please come to seated. Welcome back. So again, just check that you're going to be comfortable. We're going to be sitting for about 10 minutes. So if you're on a chair, have your feet firmly planted on the floor, hands resting on your knees or onto your thighs. So we're going to be creating the sound VOO, V-O-O, and it's a long OO sound. And this creates a beautiful vibration which stimulates the whole vagus nerve. Remember, the vagus nerve runs all the way through the body. It's one of the longest nerves in the body. When you're chanting, just try to relax, focus on your breathing, and try and create a nice relaxed exhale as you are chanting or making the sound VOO. The sound has no meaning. It's just a sound that they have found through research and studies that is particularly effective in stimulating the vagus nerve. So getting ready to begin, you're welcome to have your eyes open if you prefer. What I would suggest is just to have a soft gaze somewhere along the floor or on the wall. If you're comfortable to have the eyes closed, you can allow them to gently close. Just take a few moments to connect into your physical body. If you need to make any adjustments, shoulders, your neck, consciously relaxing your jaw. Make sure that your back is relaxed, that you feel supported. Take one more deep breath in. And as you exhale, relax. We're going to chant VOO together. Take a deep breath in. VOO. We're going to do it 2 more times. Please just go at your own pace and make the sound for as long as is comfortable. Inhale. VOO. Take a breath. Preparing now for the final round. Take a deep breath in. VOO. The eyes are closed. Keep them closed for a few moments. Feel that tingling sensation from your throat all the way through to the lower belly. You might feel a sense of tingling, heat, or vibrations. Take one more deep breath in. Exhale, relax your body. And on the inhale, blink the eyes. So remember this practice. If you are starting to feel a bit anxious or overwhelmed, it's not recommended to practice it more than 3 times because it is quite strong. It is quite an intense vibration that you're going to create. So it's quite a strong activation of the vagus nerve. So we also want to be careful of overstimulating. So 1 to 3 rounds is enough to create that vagus nerve response. We're now going to continue with some neck movements. Please do take care if you have any neck injuries, if you have arthritis or cervical spondylitis, please avoid the forward bending movement. We're going to be learning 4 neck movements. So again, you can alternate or choose the ones that feel more comfortable for your neck. On your next inhale, reaching up tall through the crown of your head. As you exhale, lower your chin to your chest. As you inhale, we're going to tilt the chin up towards the ceiling and just go as far as is comfortable. Exhale, lower your chin to your chest. And on your inhale, raise your chin up to the ceiling. We're going to complete 1 more round. Exhale, chin to the chest. And inhale. Just go as far as is comfortable. Relax your shoulders. And then as you exhale, bring your chin parallel to the floor. Take a deep breath in. And exhale, relax. We're now going to twist the neck. So you're going to breathe in through your nose. As you exhale through your nose, you're going to turn your chin across your shoulder. Just be careful of tilting your chin up. We don't want to strain the neck. Just a nice gentle twist. Coming back to neutral. Inhale as you exhale to the other side. And then inhale, come back to neutral. 2 more rounds. Inhale in the neutral position. Exhale into the twist. Inhale into neutral position. And exhale to twist. Inhale into your final round. Remember, just go to your comfortable range of movement. It might be halfway or a little bit closer to the shoulder. And release. Inhale on the exhale in the opposite direction. And inhale to release. We're now going to bend the neck to the side. So again, as you inhale, try to lift, lengthen through the crown of your head. And as you exhale, gently lower your ear to your shoulder. Inhale, bring your head to neutral. And then exhaling to the other side. We're going to now come into the 3rd movement. We're going to bend the neck to the side. As you inhale, reaching up tall through the crown of your head. And as you exhale, lower your ear to your shoulder. Inhale, come back to neutral. And exhale to the other side. Inhale to neutral. The eyes can be open or closed if that's comfortable for you. Inhale to neutral and exhale. Inhale and exhale, relax. Inhale, finishing your last round. Exhaling to the side. As you inhale, come back to neutral. Relax, take a deep breath in. We're now going to come into the final neck movement. If you don't have any neck injuries and you don't have low or high blood pressure or vertigo, you're going to go into a full rotation. That doesn't necessarily mean you're going to take your head all the way back. You can still create a full circle, but just take your chin slightly up towards the ceiling. So again, you're going to explore your range of movement and find what feels comfortable for you. Getting ready to begin. Inhale, as you exhale, take your chin slightly forward, connect your chin to your chest. And now we're going to circle over the shoulder. Again, just go as far as is comfortable for you. Moving across the opposite shoulder, across the chest. Inhale when your throat and chest are opening. And then exhale when you move your chin across your chest. I'm using my hands just to explain the movement more clearly. You're going to just keep your hands relaxed on your knees or on your thighs. So we're going to finish the movement with the chin in line with your sternum, with the center of your chest. And then we're going to pause before we move in the opposite direction. So please remember, you can make the circle much smaller. You can create a little circle with your chin. You're still going to get that stimulation to the vagus nerve. You don't necessarily need to bring your head all the way to the chest and all the way to the back. Finishing your last round, again, you'll end with your chin in line with your sternum. Pause, take a deep breath in. Exhale, relax. And then on your inhale, you can gently float your head back to center. If it's comfortable, you can close your eyes for a moment. Observing, feeling any sensations in your neck. Again, you might feel that little bit of a tingling sensation in your throat. Relax your shoulders. Relax your jaw. On your next inhale, you can gently blink the eyes open. If you're feeling a little bit uncomfortable, just stretch out your legs, do any movements or releases your body needs, and then come back into a comfortable position on your chair, your couch, or resting on your bed. The final practice is called the chin lock, Jalanda Band. It's a very strong practice, and it's not recommended if you have high blood pressure or, again, any neck injuries. So for this practice, we're going to be holding the breath. That's why it's contraindicated if you have high blood pressure or heart conditions. You're going to inhale, hold the breath, and you're going to take your chin and you're going to lock your chin against your throat. So initially you might find you're bringing it more to the chest. That's absolutely perfect. The more you practice, the more you'll be able to eventually come into the center of your throat. We're going to be practicing 3 rounds. If you'd like to just start with 1 round, please do so, and then you can relax and just observe the practice for the 2nd and 3rd round. Please don't strain. So you're just going to pause, hold the breath for a few moments, and then you release the lock, you release your chin, and then take a nice relaxed inhale breath. Let's get ready. We're going to practice together. Inhale, hold the breath, press your chin against your throat. Again, just for a few moments, don't strain. When you feel you need to breathe in, you're then going to release the lock and inhale through the nose. Exhale, relax. 2 more rounds. If you're comfortable, I'd like to invite you to close the eyes to really focus on building up that pressure in your throat. Inhale, coming into the lock. Remember to release your lock first before you exhale. Inhale, exhale, relax. Okay, if you're feeling a little bit dizzy, please stop the practice. Preparing for the final round. Inhale, retain your breath. And again, remember you want to squeeze, lock, press your chin against your throat, and then release before you take a nice deep inhale breath. So while you're compressing, try not to breathe in. You want to hold the breath and then breathe out when you release. Close your eyes for a moment. Again, you might feel that similar tingling sensation into your throat and into your chest area. These practices are really wonderful for toning and strengthening the vagus nerve response. Your eyes were closed. You can gently blink them open. So please remember that all the practices I have taught you are going to be beneficial, but it's really important that you work with the practices that you've resonated with. So if you really love working with the breath, working with sound, then incorporate those practices into your daily routine. If you love the stretches, then focus on those. It's really important that you're enjoying the practices. So the ones that didn't resonate for you, leave them out. There's plenty of beautiful practices to choose from, and you will receive the benefit if you practice regularly, and that's the most important element. It has been my absolute privilege to guide you for these past 7 days. Thank you for your time, and I wish you well on your healing journey. Namaste.